are here for the major sexual assault referral SAC network. And I'm happy as the chair of the network. We are here to reaffirm our commitment to elimination of all forms of sexual and gender-based violence.
Do you know that we now have 29 sexual assault referral centers across 17 states, and they have treated 15,800 cases as at September 2020 and given succor to many?
We expect that all these efforts will be sustained, and there will be more actions to back up the talk from those in authority and at all levels. There will be more results in terms of pursuing justice for survivors through increasing the number of cases being prosecuted.
Now, this very positive outlook is, of course, happening at a time where otherwise the situation is very somber. So there's still a long way to go, and it's too soon to rest on our laurels. But I think it is also a time to celebrate the very significant advances that we have seen over the past few years in Nigeria.
An offender was in the agency and he was captured. So I purposely put on the database and showed him names of those that have been convicted. And I said, if you are convicted, your name will be there and everybody will see you as an offender. Then the man just broke down and started crying.
Kaduna State has concluded plans to build the capacity of community primary health caregivers and social workers, and trained personnel will be mobilized to provide services in the proposed Children and Women's Center.
I don't know why. Most of the time I look forward to see where wives will batter their husbands. But in most cases what you get is women being battered. One woman was brought into NAPTIP and her tympanic membrane was already battered because somebody gave her a blow on her ears. So is this what we are going to keep contending? And before you know it, the family will come and tell you that, no, it's a family issue. Let us take it back to the family. Please, we need more orientation.
While we are talking about this issue of sexual offenders register, it's meant to be a deterrent. But we must go to the basics, which is education, continuing education, advocacy. And we need to go from primary school.
As in Nigeria, which most of us are, all these things have challenges, and MBS as an institution, we have to take it out so that we all know, and those of us who are to assist us to make it work, we can know what to do.
Mirabel Center has seen over 5,829 clients in the past 7 years. Our youngest client is a 3-month-old baby, and the oldest is an 80-year-old grandmother. We have seen 157 male clients. And from our records, the vulnerable age is the ages between 6 and 15. We have also seen a number of persons with disabilities. Over 70 of them have come to the center to seek help.
We are not yet where we would prefer to be. There are many challenges of coordination between the federal and state level, of putting the legislation and policies into action, even though the work has not fully been done, but hands remain on deck.
We are committed to advancing the effective approaches to keeping women and girls safe through evidence-based interventions. While we make certain that perpetrators are identified and punished, a greater part of our efforts should go into ensuring that we do all in our power to prevent the abuse from happening in the first place. Mr. President has consistently reiterated government's determination to fight gender-based violence through the instrumentality of the law and awareness creation. We must applaud the 17 states across the nation who have adopted perhaps our most revolutionary gender-responsive law, the Violence Against Persons Prohibition Act 2015.
Majority of the victims are between the ages 0 to 15 or thereabout. They all fall into the school age. Therefore, awareness should go to the communities, especially to the schools. Once we're able to get the community enlightened, people will begin to speak up. As I speak, I have 2 girls that I'm taking care of, 5 to 7. They are molested by their father. But the good news is that the father has been jailed. But I'm now the mother of these 2 little girls.
There should be system within the community to be able to detect sexual-based violence. And even within the school system, that when a child goes to the school, there should be a mechanism by which the symptoms of abuse can be picked. I think that, we really need to focus more on socialization, on dealing with correct interpretation of religion, on understanding that culture is dynamic and change.
This is critical because there is an extensive gap between so many communities that exist across many states. One of the things that we've been trying to do has been setting up, response centers in the shape of, the persons that are already living within these communities, and these are young people that have access to community leaders and that have the capacity to be able to sensitize communities, sensitize individuals, even within their own streets where they live. So what this is supposed to be is sort of a network that bridges the gap between the emergency response centers and the victims.
Like for the National Human Rights Commission, what we have done is that we have a call center which was established in collaboration with the EU Spoiler Initiative and OSIWA and the Office of the Vice President and the National Communications Commission. The idea about this is this: anybody who has an issue of sexual and gender-based violence can call in there, and the case will be analyzed. What solution do you need? Is it to take the person to the hospital for some medicals? You will be referred to a service provider who does that. Is it issue of counseling and trauma? You refer them to a service provider who does that. Is it the issue of prosecution? You link up with the police to do that. Is it the issue of access to justice? You link them to FIDA or MDA. So there are so many aspects, and all that you need is that the agency who has been empowered to do this must be up to its game and coordinate others so that we can all achieve the purpose.
I have been knocking on the doors of not only Mr. Governor, who would tell me, why are you talking to me? Go and talk to Commissioner for Health. So I am very alert during the budget making period. I keep my ears to the ground. So I call round Commissioner for Health. My dear brother, how are you? You have not been asking after me. I heard that you are preparing the budget now. I make the same call to Commissioner for Education, Commissioner for Information, and so on. And that's where the funding comes from. We need to follow the money as First Ladies, because we don't have any money of our own.